Hello, I'm Chris Kammer, the dentist, here today to save lives. That's right. Whoever thought a dentist would be getting involved in saving people's lives, especially when it comes to heart attack and stroke. But I want to say that a lot of the early signs of heart attack and stroke are being missed, and I think it's time for the dental community to step it up and do what we can to find these early risk signs. Somebody's got to do it because it's not being done. There's still far too many heart attacks and strokes going on. So I want the dental community to really do something amazing. Why am I so concerned about cardiovascular disease? Well, everyone should be concerned about cardiovascular disease because it is the disease that's been killing us. Yes, the number one disease that's been killing us for over 100 years, right? It's the number one disease. So that just keeps happening. Are we just going to accept that? I don't think so. I mean, come on, really. Who wants a heart attack? Nobody wants a heart attack. So let's start reclaiming personal responsibility for our own health. And I'm saying that medical screening leads the way, and that's what we are doing in dentistry. So it's quiz time right now, okay? So you think about this. What's the first symptom in 50% of the people that die sudden death from a heart attack? What's their first symptom, right? I'll tell you what their first symptom is. It's right here. Oh my gosh, yes, it's sudden death. What does that tell you? If 50% of the people that are having heart attacks and are dying from them, right, of all people that have heart attacks, 50% of them die suddenly. And the reason they say suddenly is because there was no warning. And so why is that the case? Yes, there would have been warnings. The warnings would have been found possibly by a dentist, possibly by somebody looking for early risk signs, but not enough of that is going on. So that's my concern. That's why in dentistry, we can be doing it. I mean, we own the secret killer. The secret killer, according to Time magazine, is the reason that people are dying from heart attack, stroke, cancer, diabetes, all those things. The secret killer is chronic inflammation, and dentistry owns chronic inflammation. The number one source of inflammation of the whole body is right in here. It's inside our mouths, it's our gums, gum disease, inflammation, infection. So dentists should be all over this, trying to reduce people's risk of heart attack and stroke. So inflammation can cause a whole host of things, from pulmonary disease to neurological disease, autoimmune disease, arthritis. But right now we're talking about cardiovascular disease. That's what we're talking about. So a couple of my mentors in this whole field are Doctors Brad Bale and Amy Doneen of the Bale-Doneen method. Okay, and they wrote this book here called Beat the Heart Attack Gene. Right, and they get the oral systemic connection. Dr. Brad Bale said that if he could take one test on people, just one test, to screen for early risk for heart disease and stroke, it would be what we call the CIMT. That's the carotid intima media thickness test. And here's what an artery looks like. Now this is the cross section of the artery. And as we age and fats are going through our bloodstream, they find a way to sort of line up inside the artery. And as they line up inside the artery, I don't know if you can see that, okay? I hope you can see that, all right? As they line up inside the artery, they start to make that artery lining thicker and thicker. And the thicker that it gets, the harder it is for blood to flow through there. So pretty soon over time, this sometimes can take decades. That's why, though, we can look for this in an early stage. By the time this is 90% blocked, people can still pass their stress test. That's an archaic way of looking for early risk in the medical world, a stress test. You could be that blocked and still pass your stress test. That's just nuts. So we got to be looking for something earlier than that. So what it is a carotid intima media thickness test. Now we can take a device like this in the dental office right now, and we can line it up and start looking for the carotid arteries, and then get a picture of those carotid arteries. Look, this is me. That's my blood flowing through there right now. Okay? We can get a good look inside the body just like that, and we can be looking for that thickening of those arteries. Something like this is easy to use in the dental office or outside the dental office, but this is the tool that I think all dentists will start using very, very soon. Or, nothing happens terribly fast in dentistry, but why not? Why wouldn't we be using that? Because we actually have in our hands the pathogens. When I said that the most common inflammatory disease process of the whole body is gum disease, the pathogens or the bacteria that's involved in gum disease actually causes that atherosclerosis, those fats lining up in the arteries, and we can identify those fats. So as long as we are in charge of this, and it's a normal part of our head and neck exam to check the neck, we should be putting an ultrasound device on the carotids to see if they're impacted by the inflammation and infection going on in people's mouths. So this is my carotid artery right there, and let's see, no, that wasn't it. Let's see, where did it go? Here it is. There it is. That's me. Once again, I took a picture of that and put it in my program here. But let me tell you a little something about the carotid arteries. You know, this is the common carotid artery here, and it looks like this is a good one. This is one that we found in our office that shows some fats there blocking where the common carotid turns into the internal carotid. Now that goes up into the brain, so you don't want to see that. But if you can identify that in the dental office, you're going to be a lifesaver. And that's what we're talking about, saving lives. And so this is trouble. That's trouble right there. That blockage right there. And I don't know if we can get a close-up on that, but that is what we call stenosis. That artery is being blocked and clogged, and that can lead to less flow to the brain. That can also lead to complete blockage. It could contribute to a stroke or even a heart attack. So of course, in the dental world, we want to be looking for those things. This is what I'm trying to bring to the dental world. We are doing training on the CIMT, a portable usage here that can be read by, you can read it right off your iPad screen, and we're doing this in my office coming up. So check the information below and come visit us, and we'll teach you how to do that, and you can save lives. Yes, dentistry, dentists and hygienists and even assistants. We'll teach you how to use this, and then you can go out and be saving lives in your community. Nice talking to you. Take care.